Helminthiasis or worm infestation is common in the developing nations, at least. So, the how do they present? By far, the common is the roundworm and the threadworm. There are few more, spinworm and others. They present with the abdominal pain. When child eats, then the food goes into the tummy, stomach and jejunum, and the helminth go on moving to catch the food, and thereby there is little amount of movement and little amount of pain. And at times when they are quite large, infestation is quite large, you have the vomiting. In long term, more severe cases, you have the growth failure because the nutritions of the child are being taken or eaten up by the helminths. It's quite common. Anemia is common in this child, and then they have other deficiency, vitamin deficiency is also common. And at one time of in this part of the globe, still I think it exists in many of the developing nations like us, have intestinal obstruction and other serious complications like biliary tract obstruction, the jaundice, pancreatic duct obstruction, pancreatitis, and other complications like urinary tract infections in the female, in the girls. So these are the wide variety presentation of helminthiasis in developing nations. How to diagnose? Diagnosis is clinical most of the time. Parents say, how do you say it is helminth? This is compatible clinical features and response with the anthelmintic, the drug that kills these the parasites is the answer. So you do not need to investigate. When do you investigate really? When there is obstruction, you do an X-ray abdomen in erect posture to look for the intestinal obstruction, three fluid level, and absent bowel sound. When you have the other serious sort of rare complications like hepatitis, you investigate for the hepatic fat panels, bilirubin, ALT, and others, and ultrasound. And pancreatic duct obstruction, do investigate for the pancreatic enzymes, lipase, amylase, and so forth. And urinary tract infection, UTI, urinary culture, etc. And at times the helminth, when they migrate into the lung, once upon a time may be common low flush syndrome. You can have little bit of cough and your respiratory symptoms. So eosinophilia is common in helminthiasis, and your the growth failure is common, and low hemoglobin is quite common, and other sort of nutritional compromise once upon a time was very common. Perhaps it still exists in the low and low middle income countries. So hygiene interrupting the life cycle of the helminth, and your measures to your hand washing, your and the cleaning the utensils, and clean environment, clean home, clean food, the safe food. They are the ways to prevent helminthiasis.